Hey, it's Nurse Kel. Today I'm going to be talking about nursing school clinicals and how to make them just a little less stressful. I know that clinicals can be overwhelming for nursing students. I myself have gone through them and I've been teaching clinical for the last couple years, so I know that clinicals are daunting. I do really believe that clinicals can be the best part of nursing school if you have the right approach. So I'm going to give you guys some tips to help you be successful in your clinicals and have them be a really great experience for you. So number one is to be prepared, which I know sounds obvious, but there's a couple things that you can do to make sure that you have everything you absolutely need and that you never find yourself in a situation where you're docked for points because you didn't have things that you needed or you don't have the tools you need to perform the nursing skills that you need to do. So my number one thing that I always tell my students is to have a list just in your phones, like on your notes app or whatever, that has everything that you need to bring to clinical. I even do this myself as an instructor because it helps so much on the mornings or the days, whatever time your clinicals are. When you are running out the door, you're worried that you're forgetting something, and you can just hurry and scroll through it and say, okay, I've got everything. There's been a couple times where I have almost forgotten my badge or my lab coat or something really important, and so that helps me. I also would recommend having a place where everything that goes to clinical stays. So whether that's a bag or maybe a binder, depending what clinical homework or paperwork you have to do when you're there, so it's all together. The place I used to teach clinicals at, they kind of had a rolling program, and so it seems like after like 6 to 9 months in the program, a lot of my students would say, Mikkel, I finally got a binder for all my homework so I don't forget it and get docked points. And it just makes me laugh. So if you can start off that way, start off organized, it will be a great experience for you. And depending what school you go to and what facilities you do your clinicals at, that will kind of change what things you need to be bringing, but I do have a good list based on the schools that I've taught at of what you would need to bring. So first and foremost is your scrubs. Typically, you will be wearing scrubs that are affiliated with the school that you are going to, and you may have to have a badge for your school and or for your facility depending on where you're going. So those are the most important things I would say, obviously. Also, socks, compression socks are really great, especially if you haven't done 12-hour shifts before. Those can be a lifesaver. And then shoes, every school is going to have different rules for what kind of shoes you need to wear. Some of them are more picky than others, so just follow their recommendations there. I would say though, if you have not worn the shoes before, if you bought them just for clinical, try to break them in before clinical. I've had so many students on our first day of clinical after like 2 or 3 hours who are just miserable because they hadn't broken in their shoes yet and they're really uncomfortable. So try to break them in before if you can. And then also any other tools that you're going to need throughout your clinical day. So typically every nursing student is going to have to bring a stethoscope and a pen light in order to do their assessments. I would also recommend bringing a pen and either like a notepad or a sheet of paper so you can take notes throughout your day. Sometimes if your nurse is really nice, they will print you their report sheet, whatever they take report on. A lot of them will call it their brain. If they're really nice, they'll print you one. If not, it's nice to have a blank sheet of paper where you can take notes during shift change. I think it just shows your nurses that you are ready and care to learn about the patients and you're going to be an active participant in clinical that day. I've had nurses come back to me and say they just sat there during report. They didn't even care. And so I've encouraged my students since then to be really active in report and taking notes. Even if you don't know what they mean and you have to look them up later or ask your instructor, at least write down the acronyms. There's so many acronyms. Anyway, so that's it for preparedness. The second one is having a good attitude, which please don't roll your eyes at me. I know that's a little bit lame to say, but in my experience in nursing schools, seeing my peers go through and then teaching, the students that have great attitudes are the ones that get the cool experiences. And I know that not everyone has that type of personality, but please just fake it till you make it for 12 hours and get the most out of your clinical experience. When I was going through nursing school, I have a baby face. Imagine this face, I don't know, 4 or 5 years ago, however long it was. people were not super nice to me. I got asked if I drove myself to clinical or if I had to be dropped off. People asked me all the time if I was still in high school or if I was old enough to be a nursing student or a nurse. And I just got tired of like having to prove myself every time to a new nurse that I was competent and that I was smart. And my mindset kind of shifted into being like, I'm just going to do whatever I have to make this nurse like me and to be helpful. That's all I care about, which is fine. It's great to be helpful. It's great to be well liked, but that's not the purpose of your clinical experience, right? You're there to learn. So try to be helpful. That's great. But when it comes down to it, this is your chance to learn. Nobody's going to expect you to know everything. You are still the student. You're supposed to learn. You're not supposed to know everything. So be involved. The students I have that are just super excited and make it very clear, like, I would love to do a Foley if we get a chance for a Foley or an IV or whatever skill you're, seeking to do, who just have a great attitude, have a good rapport with their patients, and get to know the nurses. Those are the students that get the most opportunities. And I used to think it was, just kind of luck when I would have like a day in nursing school, like, oh man, I didn't get to do anything today. My nurse let me do this and I guess it was cool. That's kind of how my day went. But the students I see that are just super excited, they have a great experience. There's also students, I will say there's another genre. So there's like super excited, let's do it. There's shy, reserved, won't ask to do anything. And then the third group of students typically are the ones that have just a bad attitude and feel like they never have a good assignment. Their nurses are never nice to them. Nothing cool ever happens when they're there. And that's what happens. And it's, as much as it seems weird to think about, like, you really attract things. And so if you have a good attitude, your day will be great. I promise you. And so to kind of go along with that, I really believe in affirmations, which I know are a little bit hippy-dippy for some people. I have been doing them for probably about a year or so, and they kind of feel weird. I don't know, I guess if you don't know what affirmations are, it's basically a statement that you either read out loud all the time or you just, think over and over in your brain, and it kind of shifts your mindset into becoming the kind of person that you want to be, or developing a trait that you want to develop. And it's really awesome. So I would say on your way to clinical in the car or at nighttime before clinical, or writing it on a sticky note on, putting it on your mirror or something, can really be helpful. So an affirmation that sounds something like, I love clinical. I'm so excited. I'm going to learn so many new things today. I love making connections with the nurses and the patients. My instructor appreciates what a great student I am, and clinicals are my favorite part of nursing school. Anything like that you can just say over and over and over, it will become true. And I know it sounds weird. I started off just doing a few affirmations every day, and it feels weird. It feels like a lie because it's not true yet, but it totally can become true the more that you say it. So take that for what it's worth. If you think it's weird, you don't have to try it, but it works for me. I literally have 20 affirmations or more typed up in my phone that I say as often as I can. In the morning when I'm getting ready, every time I fill up my water bottle, I say them. And a lot of cool things have shifted in my life to make me the kind of person I want to be, because by nature, I am not an outgoing person. I am very reserved, very shy. I do not like talking to people, but I want to change. I want to be different. And so that's helped me a lot personally. Another thing for clinical is your nursing skills, which I know are hard. They're hard to get down, and the only way that you get them down is through practice and repetition. And there's actually research that shows that even if you're not physically doing something like a nursing skill or any skill that you're learning, the more that you cognitively think through it, think through the steps, the order of it, how you would go about doing it, it's almost as effective as physically practicing it. And so even if you don't get a whole lot of opportunities to do certain skills in nursing school, just thinking through the process can help you so much, help your confidence be a lot greater the first time you go to do them. So maybe if you're in the car, if you can do this safely, obviously, if you're in the car and you're thinking that on the way to clinical, okay, if someone asks me to do a Foley today, what's the first thing I'm going to do? I'm going to go into the patient's room, I'm going to get all my equipment. Walking through it just helps you to be more prepared and more confident. And you will get the nursing skills. I know they're daunting. you'll get them. You'll get them. The last thing that I would touch on is communication. So your nursing instructor, as well as the nurses that you're working with, really, really will appreciate you if you are good at communicating. And it's not that hard to be a good communicator. You need to communicate with your instructor if you are going to be late. This is one of my pet peeves because sometimes nursing students just show up and they think they don't need to call me, even though we've clearly discussed it. So make sure your instructor knows where you are if you are late. Don't just text your peers, that's not enough. And also working with your nurse throughout the day, make sure you're communicating really well what time they can expect to be working with you. So typically most nursing schools will have a little conference in the middle of the day or maybe at the end of the day. Sometimes you'll eat lunch with your nurse or with your instructor, whatever. Just make sure your nurse knows when to expect you so it doesn't seem like you just ditched for an hour and then all of a sudden you're back. And that can also help them in coordinating their cares for the day, so maybe they can have you be there when they're doing more like exciting stuff that you would want to be a part of. So be a good communicator. Those are the tips that I have for you in clinical. I hope you have a great experience. I know they can be nerve-wracking. But I think through using these tips and really just having a great attitude and believing that it will be a good experience, I think you'll find that clinicals can be really fun.